Probably maybe have heard about these gel shots. They actually did, I use a synthetic one right now that's made by a company, but they did used to make these from the combs of a rooster. And basically it's hyaluronic acid, which is something that's in our body or in our joints already. But if you see one of these or have had one of these, it's a thick gel. And sometimes they come in a series of 3 shots, sometimes 5. The reason I use this synthetic one is because it's just a one-time shot, and they found it to be just as effective as having 3 or 5. So unless you like getting your knee poked 5 times, you can pick the 5, but I prefer just the 1. These have varying degrees of success. Again, I try to use these in patients with moderate arthritis that aren't down to bone on bone, and the whole idea is you inject this fluid, which is it's a gel basically, into the knee, and it's going to coat the end of the bones and kind of fill in those cracks and crevices that your arthritis has caused, and try to give you a good shock absorber to walk on. And basically that's all it does. It does wear out over time. Some patients get anywhere from 6 to 9 months of relief. Sometimes I'd say it's about 70% effective. Some patients don't get any relief, and sometimes I don't know why that is, but it could be that their arthritis is just more advanced than the x-rays appear. But sometimes it's worth trying, especially if you're not ready to have your knee replaced, because that's, you know, the next step. Again, it's a natural substance that lubricates our joints. It's an injection, and you can see here, you know, some studies show 80 to 85% of people that get the injections can get some pain relief anywhere from 9 to 12 months. But that's real variable. Again, it can go anywhere from, I see a couple guys that are farmers in the community every 6 months, because you can basically, the insurance companies will approve them for every 6 months, and at about 6 months and 1 day they're back in the office getting their injection because they know it's time. But they get, you know, 6 months of good wear and tear with that injection. So I think they can be helpful, and I think it's a good treatment that has really low side effects as far as, you know, anything, you know, to injure the joint at all from the injection.